presentation can just be uploaded. It's starting, sir. Yes, sir, you're good to go.
Namaste, good evening. I am very happy, feel very honored to participate in the seminar organized by Dutta Papeshwar, and I am associated with that company. I thank one and all from that organization. Today we are going to talk about renal disorders in Ayurveda with special reference to diabetic nephropathy. We will talk about strategies, scope, diseases, management, limitations, and the future. Basic anatomy, rewinding the anatomy. Kidney measures 11 into 6 into 3 centimeter and its weight is 120 to 170 grams. They occupy the retroperitoneal space on either side of the vertebral column from D12 to L3. Kidney receives blood supply through the renal artery which arises from aorta. Renal veins drain into inferior vena cava. Male urethra is 17 to 23 centimeter. Female urethra is 2.5 to 3.5 centimeter. Ureter length is up to 30 centimeter. Urine pH is 4.5 to 7.5. Bladder can hold up to 500 ml of urine. When I talk about male urethra, 17 to 23, in Uttaravasti, we will be inserting 6 angulas, that is 12 centimeter. So the Uttaravasti told in Shastra is intrapenile. Actually, many people do catheterization, remove the urine from the bladder, and then they inject the medicine. Up to 23 centimeter, our insertion will not cross. A healthy adult should produce at least 400 ml of urine. More than 3 liters is polyuria, less than 300 ml is oliguria, less than 50 ml is anuria. Normal kidneys can eliminate up to 10 liters of water in 24 hours. Specific gravity is 1002 to 1030. Mutra Bindu Varichandal talks about that. Mutram is considered as a mala. Mutram is the Kleda Rupam of Kapha. Kledam, Abhishanti, Kavaigunyam, Dadubhagam, Malasanjayam, Agnidushti. These are all the basic words we use in Samprati. It is a Malarupam. Kapha Pittam Malam Keshu. Kapham and Pittam are eliminated through Mutra. Through sweat, Pittam is eliminated. Through urine, Kapham and Pittam are eliminated. Proteins, bile salts, pigments. Through motion, Vada, Pitta, Kapham are eliminated. That is why Virejanam is a Purna Shodhana. Diseases of Mutravaga Srodhas are unique. Directly involved disease. Mutragadam, Mutrakrachram, Ashmari. Indirectly, urinary symptoms are told in Pramegam, Shodham, Udaram, Gulmam and Udavartam. Ayurvedic anatomy. They were giving importance to bladder only. Hridayam, Basti, Shiras, Trimarmiyam and all, they were giving importance to bladder. That word Vrikka was quoted here and there. Medovahanam Srodasam Vrikka Moolam. Panchadasa Koshtangani, Vrikkam is there. So it is situated in the Koshta. It is derived from Matru Bhava, derived from Rektameda Prasada, Vrikkau Kuchigolagau. That is a quotation, very famous. Situated, Dalgana says, Vrikkau Dau, Yekaha Vamaparshvastidaha, Dudiyaga Dashinaparshvastidaha. Around 10th or 11th century only, a proper definition of Vrikka is narrated. Vrikka not only include kidney, but suprarenal glands also. The whole renal system with the suprarenal gland is included. Marmas related to Virka. There are 5 marmas. Vasti marmam, Kukuntara marmam, Nidamba marmam, Lohidaksha marmam, Vitapa marmam. Vasti is a Satyapranagara marmam. Vasti is a Vada Pradhanya Satyapranagara marmam. Virdayam is Pitta Pradhanya Satyapranagara marmam. Shiras is Kapha Pradhanya Satyapranagara marmam. So it is a Snayu marmam, clinical importance. It is a Gulma Sthana. Vasti is a Gulma Sthana. Diseases of prostate and all are talked with the concept of Gulma by a Kaya Chikitsa doctor. Varunadikashayam, Chiravilvadikashayam, Chandraprabhavadi, Sukumara Legium. This is the prescription for Gulma. But this is Kapagaram, Sophaganam, Anulomanam in nature. Even for prostate, this principle is applicable. So, Gulmam is a vast chapter in which Vada Kapha Dushti is predominant. A hypochondrial area, medial subumbilical swelling, dull on percussion. It is the seat of Vayu, site of action of Uttravasti. Kugundara Marmam, it is a Sandhi Marmam, Vaigalyagara Marmam. Injury to parasympathetic nerve fibers can produce neurological bladder. Kugundara Marma Abhigadam can produce paraplegia, Adakaya Sadam. Nidambam is Asti Marma, Kalandra Pranagara Marma. It is not directly involved, can be affected in renal osteodystrophy. Lohidaksham, red-eyed region. It is a Sira Marma of 2 in number and Vaigalyagaram in nature. This can be affected in vascular renal disorders. Mutravaga Srodhas, according to Charaka, Vasti, Vankshana. According to Susruda, Vasti and Medram. Qualities of Mutra, Katu, ammonia, smell, Tishnam, acidic, Ushnam, warm, Lagu. Mutravaga Srodho Dushti Lakshanam. Adisrishtam, polyuria, voiding too much, RIUM and bladder. Adibaddam, oliguria, LM bladder, obstruction, atonia, Bahalam, turbid, Sasulam, Mutrayantam. Dysuria associated with frequency, Sulam. Dysuria means painful urination. Mutra Vegaroda Lakshana, Vasti Metra, Vankshana Vedana, renal and uretary colic, Mutra Krichram, Shirasulam, Admanam, Anaham. These are all the features of Mutra Vegaroda Lakshana told in Ashtanga Hridayam Naroganutpadaniyam 4th chapter. Here, for this Mutra Vegaroda Lakshanas, Avabidaga Snegam is indicated. The reference about Avabidaga Snegam is told in Ashtanga Hridayam Sutram 4th chapter, Charagam Rekta Arshas context, Kasyapa, Vadavitta Samanam, and Grishya. Thailam is not selected for Avabhidagam. Thailam is Baddha Vindmutram in nature. It will produce constipation. So Gridam is selected. In Avabhidaga Snegavana, 2 times medicines are given. This Aushadha Kala is called Samudga Aushadha Kala. So first 1/3 of the Gridam is given, then 3/4 is given. Morning after Snana, 100 ml of ghee is given, then food is given. Once it is digested, remaining part of 200 ml is given. So Mutra Krichra comes under Uttama Snega Matra Arha. That is that which is digested in 24 hours. Usually we give Madhyama Matra. Harsi Garsi Matra also should be tried. Arunadatta, Hemadri talks about that. Avabhidaga Snegam is a Samana Snegavana. Up to what time you can do until you get Roga Samana Lakshanas, it can be done. This is about Avabhidaga Snegavanam. That's what we are practicing. Now, Ayurvedic interpretation of various renal organs, Andakosham, scrotum, Susruda, Gavani, ureter, Atharva Veda, Mutravaga Damanyo, Susruta Samhita, Purushendriyam, Medram, penis, Dalghana, Vakyanam, Susurdam, Basti, suprapubic region and bladder. Lot of references from Susurdha Nidanam and Vagbada. Virko, kidney. The word Virko is mentioned in Saraka Sariram, Susurdha Sariram. Mutra Pudam, urinary bladder. Lot of references are there. Mutra Padam, urethra. That also Charagam, Chikissa, Susurdam, Chikissa, Nidanam, Vagbadam, Dalganam, Bhava Prakasham. So many references are there. Vastikukshi, hypochondrium, Susurdam, Utram, there is reference. Metra Dwaram, external urethral orifice, Dalghana Nidanam, Madhukosha Nidanam, it is there. Ayurvedic perspective of renal diseases. Mutragadam, Mutrakrachram, Ashmari, Shodam, Pramegam, Sayyamutram, Jwaram, and Udardam. These are all the areas where renal diseases are talked. Mutravaga Srododushti can be divided into two categories. Apravarti Janya Rogam, Adipravarti Janya Rogam. Apravarti Janya Rogam, Mutragadam, Mutra Krichram. Adipravarti Janya Rogam, Pramegam. There are 13 types of Mutragada. Mutragada means neurological, something nephrological, something surgical. Separate medicines for each Mutragadam is not told. First one is Vasti Kundaliga, atonic bladder with overflow incontinence. Nephrological, Mutra Sukram, spermatoria, Ushna Vadam, cystourethritis, Mutra Sadam, Chailuria, Mutra Kshayam, Oliguria, Vada Kundaliga, spasmodic painful dysmenorrhea, dysuria, Vada Ashtila, BPH, Vada Vasti, bladder neck obstruction with retention of urine. Mutra Adidam, bladder atonia, Mutra Jadaram, bladder outlet obstruction, Mutra Utsanga, stricture urethra, Vitvigadam, vesiculo-urethral fistula, and Mutra Grandi, mass or tumor in the bladder or in the prostate. So beautifully they have narrated most of the diseases of urology. The medical branch of kidney disease is called nephrology. The surgical branch of kidney disease is called urology. Involvement of Vada can produce neurological bladder and change in the void of the urine. Pitta produces pH imbalance and dysuria, Mutra Krichram. Involvement of Kapha produces polyuria, proteinuria, etc. Samanya Chikisa of Mutra Vakasrodas, Samanam, Shodhanam, Virejanam, Abhyangam, Avagagasvedam, Avabhidagasnegavanam, Vasti, Uttaravasti. Mutra Krichram. Here Chalagunam of Vada is reduced, Ushna Tikshnam of Pitta is increased, Snigdam of Kapha is reduced. There are a lot of textual slogas for understanding classical Mutra Krichra Lakshana. From my experience, I interpret like this: Vataja Mutra Krichram, kidney stone; Pittaja Mutra Krichram, acidic urine; Kaphaja Mutra Krichram, BPH with secondary infection; Sannibada Mutra Krichram, chronic UTI. In Vadaja Mutra Krichram, we will be giving Brigatyadi, Sugumaram, Veeradaradi. Veeradaradi, Bhadradarvadi, Vidaryadi are the three ganas told for Vada. Veeradaradi, Vada Samanam; Bhadradarvadi, Vada Kapha Samanam; Vidaryadi, Vada Pitta Samanam. That is the beauty of the three ganas. Pittam Kogilaksham, Sadavaryadi Kashaya. Kafam Varunadi, Varunadi Kafam Medo, Mandakritvam Niyasadi, Adyavadam Shirasulam, Gulmamcha Antarvidradim. Varunadi is given in prostrate, renal artery stenosis. Varunadi is the choice of drug for Kaphavada urinary diseases. Punarnavadi, Patya Punarnavadi, Churnam in Vada, Gokshuradi. Goksharam is Madhura Rasam, Madhara Vivagam, Shita Viryam, Snigdha Gunam, Vada Pitta Samanam, Kapavardhanam, Sarayuktam. It works on Sukravaga and Mutravaga Srodhas. For Pittam Sudarsanam, Bunimbam. Bunimbam is Tiktarasam, Ruksham, Shidam, Pitta Samanam, Kapasamanam, Daga Prasamanam. Then Ashtanga Gradiyam Shloka Chikitsa, Ajadi Padadi Churnam is there, which is Vada Kafakaram with Takram. Takram is also Vada Kafakaram, Ruksham, given in Kapha disorders. Kridam, Sugumara Kridam. Actually, it is Gudayukta Yamala Sukumara Rasayanam. It contains Sarkara, it is not a lehium. It contains Gridam and Yerandadailam. It is Yamalam. It contains Thavara Snega. It contains Jangama Snega. It contains Trinavanjamulam. It works on Shukravaga Srodhas, Mutravaga Srodhas, and it is a Pumsavana, male Pumsavana Visesha Yoga. So Sugumara Gridam is useful in Vadaja Mutra Krichitra after Amavastha is over. Then Vastyamayandaga Gridam and Brigatyadi Gridam. Brigatyadi means Lagavadya Pitta Sadavaryadi Trinakandagadya Gridam. For Kapha, we will not give Gridam. Arishtam. Pittam, usually Arishtam is not given, but Sharibadi Asavam and Chandanasavam. Chandanasavam is Pudi Megha Nasanam Param. Saribadi Asavam is told in Vaishajya Ratnavali Pramega Padaga Chikitsa. Pramega Padagam, we are going to talk about that while we talk about diabetes. Punarnavasavam for Kapha. When you write Punarnavasavam, people think Punarnavasavam contains lot of Punarnava, but only 50 grams Punarnava is there. 8 kilos of Draksha is there in Punarnavasavam. So it is Madhura Rasam Sofagram should be given in conditions like right heart failure, etc. Lehiam, Vadam Sadavari, Pittam Sadavari, Kafam, Kamsa Haridegi, that is Dasamula Haridegi. Vadi, Vadam Gokshiradi, Pittam Chandanadi Vadi, Kafam Gokshiradi Guguru, Sandraprabha. Sandraprabha means Pachakarpuram, Sandraprabha means Bakuji also. Ashmari, renal stones. Vadashmari is Shava Aruna Varnam, Kantayuktam. Pittashmari looks like Balladaga Asti, red, yellow or black in color. Kafam is Lakshanam Mahat, Sweda Varnam, Madhu Varnam. So Vadashmari is calcium oxalate stone. The medicines are Veeradaradi, Gokshuradi Gukuru, Sugumaraleyam. Uric acid stone is a Pittashmari, Brigatyadi, Punarnavadi, Sadavari. Kafashmari is phosphate stones, Varnadi, Shigruvadi, Chandraprabha, Dasamula Haridagi, Kalyana Ksharam. Ksharam, change in pH helps in the disintegration of stone. Amlena Saka Samyuktaga, Satishna Lavano Rasaga, Madhuryam Bajade Atyartam, Tishna Bhavam Vimanjadi. So Ksharam, when you give, acidic will become alkaline. So it is a changing the pH in the disintegration of stone is a beautiful concept told by Susruta. Hematuria. Hematuria, painful hematuria, painless hematuria. Painful hematuria means you are safe. It can be stone or UTA, commonly, infection, stone, trauma, etc. Painless hematuria, it can be cancer, it can be TB, it can be glomerulonephritis. Hematuria, Rakta Mutra Chikisa can be done. Appearance of blood in the urine may be brown. Even small drop of blood will make the whole urine red in color. Microscopic investigations are needed. Investigations why the blood is coming, from where the blood is coming. First, if blood comes, the lesion is below bladder. When blood is mixed, the lesion is from the bladder. When person passes blood at the end, it will be from the kidneys. So, in Raktapitta, in hematuria, Pittaja Mutra Krichara Chikisa, Raktapitta Chikisa, Rakta Adisara Chikisa may be adopted. While telling the Kshadarogam, Kshadakasam, Vakpada, Madhavanidana says, Uro Vibhajyade Atyartham, Mutram Shonidamevacha, Mutram Shonidamevacha. So in Urakshadam also, hematuria is told by our acharyas. Vamanam is avoided. First, we will be giving medicines like Sonidamradam, Punarnavadi, Guduchyadi, then Mutra Virejiniya Gana, then Chandanadivadi, after appetite, Sadavari Legium, Sadavari Gochura Kshira Kashayam, Pushmanda Swarasam, Danvandaradairam, Pichu. Like that, we will be giving Pittasamana, Madhura Rasa, Snigdha, Anulomana, Aushadas. Trinapanja Moolam is good for Mutra Krichram, especially hematuria. Trinapanja Moolam is told in Madhura Skandam. That is very important. There is a difference between Sophaganam and Mutralam. Sophaganam is Tiktarasam, Mutralam is Madhurasam. Gokshuradi Sadavari are Mutralam, Dasamulam Punamnama are Sophaganam. Pramegam. Pramegam is a Mahavyadi. Pramegam is a Mahavyadi. Susrada Samhita, Sutrasthana, Charaka Samhita, 7th chapter, Kenta Sarasiyam, Avarana Pramegam, Madhumegam is told. Nidanam, there is a separate chapter. Chikissasthanam, Pramega Chikissa, 6th chapter. Susruda Nidanam, 6th chapter. He uses the word Shaudramegam. Various, every mega, there is a Kashaya by Susruda that is very unique. The body constitution and symptoms are related to Sagaja Pramegam and Apatya Nimittaja Pramegam. It's also a beautiful classification. Vakpada told Dadu Kshayajanyam, Avaranajanya Pramegam. He included Svedam in the Dushya. Vadam 4 Asadhyam, Pittam 6 Yapyam, Kapha 10 Sadhyam. The 20 Pramegas are separate types, or 20 Pramegas are the 20 Avasthas of Ojomega, Madhumega. Step 1, step 2, step 3 to step 20. Two types of interpretation is possible. Urine nature in Pramega, Madhumega. Mutram Adipravrti, Avila Mutrada, Pichila Mutrada. There are a lot of comparison. We have also done Udagamegam, diabetes insipidus, Itchimegam, glycosuria, Sandramegam, chailuria, Shuklamegam, phosphaturia, Sigatamegam, crystal bladder, Sharamegam, alkaline urea, Kalamegam, very rare to see. I have not seen a case. Alkaptonuria, presence of homogenic gentisic acid, melanin occurring in metastatic melanoma, Neelamegam, Pseudomonas infection, Raktamegam, hematuria, Haridramegam, bilirubin, urobilinogen in urine, Manjishtamegam, hemoglobinuria, myoglobinuria. Like that, we have comparisons. Vitiated kapha spreads all over the body and produce Dadu Shaidilya. In Dadu Vriddhi, Dadu Dushti, there are various stages. Dadu Vriddhi, Dadu Kshayam, Dadu Dushti, Dadu Bhagam, Dadu Shaidilya, Dadu Asamagattvam. Dadu Vriddhi, it is seen in obesity. Dadu Vriddhi. Dadu Kshayam, seen in Radha Yakshma. Shukra Kshayam. Dadu Kshayam is seen in Radha Yakshma. Dadu Bhagam, seen in Jwaram. Dadu Dushti, Dadu Bhagam is seen in Raktavittam also. Pittam, Vidaktam, Sogunaihi, Vidagatyasu Sonidam. That is Dadu Bhagam. The Dadu Dushti, Vriddikshayatmakaha, it is seen in Gragani. Dadu Saidilyam, Dadunam cha Saidilyad, that is seen in Pramegam and Pandu. Then Dadu Asamagattvam, that is seen in Sofa. So while spreading, While spreading, kapha get mixed with medodadu in excess quantity and abadda and having concurrent properties of kapha. The consolidation goes and disintegration starts. Mutrasya kledavagana. Kledam is pitta pragoba lakshana. Pittasya dagaraga ushma pagidaga sweda kleda shrudi koda. Then ahara parinamagara bhava kledam is told. Pramegam kledam is told. Kushtam kledam is told. Visarpam kledam is told. So this is very important. Medasya mamsamsa shariradam cha kledam kafo vastigadam pradushya. Kapha gets vitiated primarily, and the causes of vitiation of concordant body elements like rasa, mamsa, medas, vasa, lasiga, kleda. Raktam is not directly told. Asti is also not directly told. But raktam, when during pramega, when raktam is involved, you get all asti, renal osteodystrophy seen in renal failure. Asti is also involved. So Tridosha, Saptadhatus, everything is involved in pramega. The following symptoms manifest in Madhumega: Shaidilyam, Alasyam, Adinidra, Gauravam. Susruda talked about Stula Pramegi, Krisha Pramegi. Due to vitiation of Rasadadu, we have Prameha Lakshanas. Alasyam, Gauravam, Krishangada, Klaibyam are seen in Madhumega. Klaibyam, most of the diabetic persons will be having erectile dysfunction. Then Raktadadu. Raktadadu is involved in Pittaja Pramega, but Raktadadu is involved. How will you understand that Raktadadu is involved? By seeing Pidaga, Vidradi, Alasi, Saraviga, Sarshaviga, etc. Mamsadadu. Avaranadanya Madhumega, Mamsadadu is Udi Mamsa Pitaga happen in Mamsadadu. Mamsa Dushti can be compared with dearrangement of protein metabolism, which is integrated part of diabetes. You can see wasting. Abaddam, Asamhadatvam, that is Abaddatva causes dearrangement of structure in Medodadu producing Shaidilya. This can be correlated with FFA excess, free fatty acids. Then Bahu, Medas is excess in quantity. This Medodadu is Aparipakwa. It obstructs the Vayu along with Kapha. This provoked Vada increases Agni, so that with the Stula people will be taking food more and more because of Agni Vriddhi. This in turn causes severe depletion of other Dadus also. Increased appetite in Medoroga is due to increased body demand, which can be explained due to hyperinsulinism, increased secretion of growth hormone or leptin. Majjadadu. Murcha is a symptom that can happen in Majja Dushti in diabetes mellitus. This can be compared to syncope seen in hyperglycemia, diabetic ketoacidosis. Shukra. In Shukra involvement, Dusha involvement, one by one we are seeing. Dusha involvement, there will be impotency in Shukra. Then Vojo Megam. Vojas, upper Vojas is Ardha Anjali. It is involved in Vada Pramegam, Madhumegam. Swedam. Swedam is told by Vagbada. The level of catecholamines, adrenaline, non-adrenaline, is increased in diabetes, which causes excessive sweating, which can lead to electrolytes such as sodium and chlorides through the skin. Swedam is also involved. Pramega rogis are durvireja, so malam is also involved. But Swedam is contraindicated in Madhumegam and in Vadaraktam. Samprapti Gadagas. Charaka described as a subtype of Vadada Pramega, that is Vasa Mega. Vasa is the Upadatu of Mamsa. The Snigdha present in the Mamsa Dhatu is called Vasa. Lasiga. Lasigam Sarira Antargada Pichila Dravabhagam. It is one of the liquid component present beneath the skin. Lasiga get initiated by Vada, resulting in Lasiga Megam. So, what are all these Srodhas involved? Purva Rupam of Pramegam, Medovaka Srodhas, Pudi Mamsa Vadaga, Mamsavaka Srodhas, Trishna, Mugha, Dalu, Kanda Sosha, Udagavaka Srodhas, Mutram, Apravarti, Adipravarti, Mutravaka Srodhas. So, these are the Srodhas involved. In Pramegi, Stula Pramegi, we have to do Udvartana with the Trifaladi Churna, then give Kashayams like Asanadi, Vatsagadi, Chandraprabhavadi, Shivaguliga, Shilajatwadi Vadagam, Nishamalaki, Trifala Churnam at bedtime, and we can give Kadaka Kadiradi Kashayam, Nishakatagadi Kashayam. Kadaka Kadiradi Kashayam is Avapitta Pramegam, Nishakatagadi is Pittakafa Pramegam. Kadaka Kadiradi can be given with honey for 7 days. Probably that may be effective in urinary infection. Persistent albuminuria, this is the treatment. Then Vada Pramegi, only little medicines are told. Stula Pramegi, so many medicines, so many Kashayam, Surasadi Ganasiddhavasti, all these things are Harakvadadi, Asanadi, Vasagadi, Shilajati, everything. Chitragadi Churnam, all these things are told for Stula Pramegi. Krisha Pramegi, Dhanvantara Kridam, Trigandaka Kridam, Apraga Sanduram, Vasanta Kusmagaram, Madhudeli Gavasti, Sosari Ganavasti, only these much medicines are available. Krisha Pramegi. Stula Pramegi, actually I used to tell insulin is Kapha, glucagon is Pitta, stomatostatin is Vada. That is the comparison usually I make. The hormones are expressions of Dhatu Agni. Diabetic nephropathy, if you find it earlier, you can stop it and cure it so that the patient will not suffer from chronic renal failure. If it is greater than urine protein is greater than 300 milligram per deciliter, that is confirmed on 2 occasions in 6 months apart. Progressive decline of glomerular filtration rate, it should be 90. Elevated arterial blood pressure, renal hypertension. Diabetic nephropathy is a progressive kidney disease caused by microangiopathy. It is characterized by nephrotic syndrome. It is due to long-standing diabetes mellitus. After 10 years, it starts. The prime indication for dialysis in many developed countries. It is classified as microvascular complication of diabetes. Diabetic nephropathy, there is no symptom. They develop in later stages. Edema will be there. Edema will be around the eyes. Akshikuda Sodam, Amalakshanam, nephrotic syndrome, it is there. Early morning, you can see that. Foamy urine caused by massive proteinuria. There will be unintentional weight gain, anorexia, nausea, vomiting, malaise, fatigue, headache, and frequent hiccups. Microalbuminuria, urine albumin spot should be less than 30 milligrams. 30 to 300 is microalbuminuria. Greater than 300 is clinical albuminuria. Glomerular, estimated glomerular filtration rate, EGFR per ml per minute per 1.73 meters square. Stage 1 is greater than or 90. In end stage renal disease, it is a calculatory method. You have only 15. Complications, hypoglycemia, rapidly progressing kidney failure, end stage kidney disease, increased potassium, hypertension, hemodialysis, complications of renal transplant, coexistence of diabetes complication, peritonitis, infection. Here we have to talk about few more things. First is renal failure, diabetic, hypertensive, lupus, drugs, IgA nephropathy, renal failure. Adipravarti and apravarti we have to consider. In some renal failure, urine output will be 100, 400 ml. In that case, you cannot give Madhurarasa Pradhanya, Kleda Vardhana, Mutra Aushadas like Sadavari, Gochura, coconut water, Bala, Ikshurasa, etc. Already the body is unable to eliminate the Mala. If you give Madhurarasa, more Kapham is produced, more Malarupa Mutram is produced. Body will not be able to send it out. So that should not be done. So in Apravarti, you have to do Nityameva Vireje, Punarnavadi Kashayam, Guduchyadi Kashayam, Narayana Churnam, Dugdavadi, Yoshadi Takkaram, Bunimba Makaushada Kalpana, told in Ashtanga Gradayam, Sofa Chikisa, Gudardraga Prayogam, Rukshavasti, told in Charaka Samhita, 10th chapter, Chakrapani, commentary. So then, if it is polyuric renal failure, when the person passes more than 3 liters of urine, then you can give Gokshuradi, Sadavariyadi, Yukshurasam, etc. Mutra Virejiniya Ganam is given. Mutra Virejaniyam is mostly for infection. It contains lotus and Shadakshiri Aushadas. It is basically a Kashaya Rasam, Sidaviryam, Kafapitta Shamanam, Stambanam. So, hypertension. Some people, Shuddha Ayurveda people say there is nothing called hypertension. But it is a asymptomatic silent disease. Udalinga Avyakta Vyadi. So you consider that as a Vada Pradhanya Roga. Then Vadanulomanam you will be doing. You will be giving Gandharastadi, Vaishwanaram, Sukumar Laikam. BP doesn't come down. You may think it is a Pittaja Roga. So you may be giving Murdvigadi, Drakshadi, Trivut Surnam Virejanam, Pravada Pishti, Kachuradi, Chiravala Talam. Then BP doesn't come down. Then you consider this as a Srodo Dushti Kava Igunya due to Kapha Pradhanya Rogam. You will be giving Varunadi, Punamnavadi, Chandraprabha. It will not be effective. Up to 160 or 100 our medicines are effective. People give Sarpagandha for everything. Sarpagandha is a Vishagara Drivya. Sarpasugandha told in Susrudam Uttaradantram. Sarpa Sugandha is told in Dandi Haridagi Legium, in Gulma Chikisa, in Ashtanga Gradaya. So Dandi Haridagi Legium, Sarpa Sugandha, people say it is Garada Kodi, Iswara Muli, not Ravalfia. So anything or everything, if it is a renal tubular acidosis, not acidosis, renal artery stenosis, you will be giving Sarpagandha. Sarpagandha is invented by an African scientist. And even in Sarpagandha, hallucination, depression, suicidal tendencies, I have not given. Now we have to find the Sambrati for hypertension, because that area I have treated for 24 years, around 6 to 7 lakh cases I have seen. I am seeing there is no very good effective medicine for hypertension. Otherwise, Ayurvedically you to tell there is no Lakshanam, Prasanna Varnendriyam is there, he is Swastha, he need not be treated. But suddenly if stroke comes, hypertension, nephropathy comes, what will you do? That is the question to be answered. In nephropathy, Kapha Pramega Chikisa is given. Ruksha Aushadas, Kledakara Aushadas, Rasayanas, Nalpamaradi Kashayam, Chadukshiri Kashayam, Asanadiganam, Vatsagadiganam, Patyapunarnavadi Kashayam, Arakvadadi Kashayam, Punarnavadi Kashayam, Nishakatagadi Kashayam, Mutra Virajaniyam Ganakashayam, Negrodadi Churnam, Nishamalaki Churnam, Trifala Churnam, Chitraka Churnam told in Ashtanga Gradaya Paramega Chikisa, Shivaguliga, Dhanvantara Guliga, Aprakasanduram, Dhanvantara Gridam in later phases, the Toya Kalpana, processing the water with Nishakatagadi, Kadira, Darugaridra, etc. This is the approach in suppose a nephropathy comes in an obese person, Arakvadadi Kashayam plus Punarnavadi Kashayam, Shivaguliga, Trifaladi Churnam at bedtime. It's very effective. It is a Kirsha Pramegi, Dhanvantara Gradam with Aprakasantura. Matra Anuvasana, this Nirukavasti, Madhudeligavasti. This will be very effective in diabetic nephropathy, in Stula Pramehi, and in Kirsha Pramehi. Then nephrotic syndrome. Nephrotic syndrome is a kidney disease in which proteinuria, hypoalbuminemia, edema will come. Diabetes can produce, lupus can produce, membranous nephropathy is there. Children, it is seen, they have 3+ proteinuria and they have increased cholesterol. That is an indication. Infection, hyperlipidemia, atherosclerosis, hypocalcemia, bone abnormalities will be there. They here also Kafaja Pramega Chikisa, Punarnavadi, Patya Punarnavadi, Puduchiadi, Santanadivadi, Sivagudiga, Lodrasavam, Madhvasavam. Gudam is a Pramega Gedu. Gudam is not added in Lodrasavam. Only Madhu is added. Gudartharaka Rasayanam, very effective in nephrotic syndrome, told in Ashtanga Gradaya Sofa Chikisa. Nephritic syndrome. Glomerular disorders. There will be proteins, red blood cells, fever, hematuria will be there, pyelonephritis and all. Here Vada Pitta or Pitta Vada Samana Chikisa is done. Protein is going. First you have to give Kogilaksham, Brigatyadi, Sadavari, then Sudarsana Churnam, Chandraprabha, then Samana Snegavanam in the last. You have to see the avastha of nephritic syndrome. If it is Kapha Pitta avastha, you should go for Nekrodadi. If it is Vada Pitta avastha, you should go for Brigatyadi, Sadavariyadi. So based on the nephritis is Vada Pitta or Pitta Vada type of features are seen, because fever, red blood cells are also seen in that condition. Drug-induced nephropathy. The NSAID painkillers will damage the kidney and produce elevated urea and creatinine. There, Punarnavadi Kashayam, Brigatyadi Kashayam, Mutra Virejaniya Kashayam, Sadavari Kashayam, Sudarsana Churnam, Dushi Vishadi Agadam, Ushirasavam, told in Vaishyajaratnavali, Raktabitta Prakarana, bladder. Coming to the bladder is neurological, urgency, frequency, hesitancy, distension, incontinence, overflow, dribbling. These many symptoms can come in bladder. So many types of incontinence, stress, urge, mixed, overflow, reflux, surgery-induced incontinence. So how will you treat incontinence of bladder? Atonic bladder. Bladder is unable to press, detrus or weakness is there and unable to send the urine outside. It is like gulma. Kapha Vadagara Chikisa. Chiravilvadi Kashaya, Ingavajadi, Inguturgana, Dhanantra Guliga, Pippelyadi Anuvasanam, Ingavajadi Kalkam. Because in Ingavajadi, Kirchalan, Gulman, Vada, Wind, Mutra Sangan. The word Mutra Sangam is told in Ingavajadi. That is the Vishesha Palasrudi. Overactive bladder, urge incontinence, you have to give Anulomanam, then Stampanam, Sugumaram Kshira Kashayam, Dhanvantaram Kashayam, Kshira Bala Tailam, Aswagandhadi Churnam, Vasanta Kusumagara tablet, Dhanvantara Tailam kept below navel region. Here, Adipravarti, that is Apravarti. Apravarti, Kafavada Chikissa, Adipravarti, Kevalavada, Madhurarasa, Snigdha Yukta Chikissa. Hydronephrosis, Udavartam, Mutraja Udavartam. It can be produced, obstruction in the urine in the pathway. Stone, tumor can produce. Stone alone we can treat. Other things, my success rate was very poor. Varunadi, Chiravilvadi, Abil Choladi, Basma Kanji, Panai Viraladi Ksharam, Pippalyadi Anuvasanam, Gudardharaka Prayogam can be given. In renal failure, Punarnavadi up to urea up to 70, creatinine up to 3.5, our medicines are effective. Punarnavadi, Guduchiadi, Ajajivadadi, Desamula Haridagi, Ayapatra Punarnava, very effective. Ayapatra Punarnava with Takram. Urinary infection, Sama Mutram. In Sama Mutram, Nishakatagadi, Chandanadi Vadi, Sudarsana Churnam. After fever is over, Mutra Swadana, Mutra Virejaniya Ganam is given. Then in order to prevent Vastiyamayantaka Gridam, Pragbhakte Abhanav, it must be given, or Samudga Ushadakala, it can be given. Mutrala Devya, Madhurasam Mutralam, Goksharam Sadavari, Amlarasam Mutralam, Kolam Dadima, Tiktarasam Mutralam, Kuduchi Sandanam, Kashayarasam working on Mutra, Arakvadam Nalpamaram, Lavanam and Kadurasam are very selectively used or not at all used in Mutravagam, except in obstruction. We may go for Ksharas. Other than that, other rasas are commonly used. Commonly used Gudigas, Chandanadivadi, Chandraprabhavadi, Gokshuradi, Punarnavadi, Shivaguliga. Shivaguliga is told in Ashtanga Sangaragam, Vajikarana Prakaranam. Asavam, Punarnavasavam, Chandanasavam, Ushirasavam, Sarivadi Asavam. Commonly used Gridam, Sadavari Gridam, Sukumara Gridam, Vasti Amayantaka Gridam, Trikantaka Gridam, Varunadi Gridam. Commonly used Rasaushadhas, Abraga Basmam, Karpura Shilajata Basmam, Chandraprabha. Chandraprabha is Rasaushadham because Swarnamakshiyam and Logam are included. Sharavarpadi, Swarnavangam, Vasanta Kusumakaram, Surakshara Kasisa Basmam. Common herbs used in renal disease. Sadavari, Punarnava, Kogilaksham, Goksharam, Varunam, Ikshirasam, Buduchi, Abhamargam, Darpa, Badra, Badradarvadi, Badra, Chandanam, Pashana Vedi, Shilajati. Rasayanam for renal disease. Savanaprasam, Sadavari Gulam, Shilajat Rasayanam, Sukumara Rasayanam, Kushmanda Rasayanam. Conditions that can be treated by Ayurvedic doctors. Renal failure up to some extent, nephrotic syndrome, infection, hypertension, nephropathy. Urological conditions, stone BPH. Neurological condition, neurological bladder. Conditions which I could not manage in my experience: acute renal failure, renal tubular acidosis, renal hypertension, tumors, structural obstructive pathology of the bladder. These conditions, my treatment was not effective. Now, in a renal failure case, first you have to see hemoglobin. After seeing the hemoglobin, you should check urea and creatinine. Creatinine is more important. Creatinine is for long-term analysis of renal system. Then only the importance of urea is coming. Sodium and potassium should be checked. Potassium should not increase. That is why you should not take fruits, bananas, and you should wash the vegetables half an hour in a basin. Then you should cook. Alkaline phosphatase, very high in renal disease, liver disease, obstructive disease, bone disease. Then phosphorus and phosphate, calcium. All the renal people need extra calcium. When protein loss is there, albumin will come down, hemoglobin will be very less. Microalbuminuria, 30 to 300 milligrams per day. Urinary albumin creatinine ratio less than 30 micrograms per day. There was a person who came with prostatitis. All the tests were normal. After sexual life, after urination, there will be burning sensation in Mutra Marga and Guda Marga. That is Pitta Vriddhi in Abanasthana. So Agandhika dosham is powerful here. So Pitta Samana medicine I have given. Brihatyadi Kashaya with Sonidamridam Kashaya and Sudarsana Vati I have given. Tiktarasam, after the Tiktarasa Prayoga is over, then Sadavariyadi Kashayam is given. Then after that, Vastiyamayandaka Gridam, 5 days, Avabhidaka Snegavanam is done. Then after Virejana with Kalyanaka Gulam, we made Kshiravasti, Matshigam, Lavanam, Snegam. In Snegam, we added Vastiyamayandaka Gridam, Kalkam, and Kashayam, Gokshuram, Kshira Kashaya. So with this fellow was suffering for a long period, and with this approach, the chronic relapsing non-bacterial prostatitis, which is called chronic pelvic pain syndrome, responded very well to Ayurvedic treatment. Glomerular filtration rate. Male it should be 70 plus, female it should be 60 plus. Microalbuminuria, very good test. 30 to 150, mild 50 to 100, moderate 50, 500 to 1000, heavy more than 3.5 grams. More than 3.5 grams of protein is called nephrotic range. With this, I have told about anatomy, Ayurvedic perspective, diabetic nephropathy, drug-induced nephropathy,